Breast cancer is a very common cancer. It's actually the #1 leading cause of cancer death in women worldwide. But we do know that even though 1 in 8 women get breast cancer, it's incredibly survivable when caught in the early stages. So it's very important that women stay on a screening plan and have discussions with their primary care physician on when that screening should start. And then once they're diagnosed, if they do fall in that 1 in 8, here at the surgery group, we would be happy to provide that comprehensive breast surgical care for them. So a woman's risk for developing breast cancer is about 1 in 8, but new studies are showing that it may even be higher. We think that's because our technology's gotten better and we're detecting it earlier and catching those cancers that might have been missed. The risk factors kind of vary. They can be something as simple as smoking will increase your risk, but other things related to your pregnancy history, your menstrual history, or your family history can affect that risk and increase it. So it's important to have that dialogue and that discussion with your primary care doc to really stratify where you fall.
The #1 symptom would be a lump or a change in the contour of the breast. And the reason it's so important to keep track of how your breasts feel is that we're really looking for changes. So you might have a part of your breast that looks a little different from the other side, but that's the way it's always been. We're interested in things that are changing from the way they were before.
We also need to understand what each woman's personal risk of developing breast cancer might be. Now, this is based on factors such as family history, previous biopsies, how many times she may have been pregnant, and if she's using estrogen replacement therapy, if she's postmenopausal. These elements can point to possibly a higher than usual level of risk, and if a patient carries a genetic mutation predisposing her toward developing breast cancer, then that's usually the most important factor. So with this information, we can know if what we feel and see in the breast is likely to be breast cancer. I spend a large amount of time in each visit explaining things and educating my patients. We talk about the details of their cancer and the overall situation so that they can better understand what we need to do and fully take care of them. Very often, a woman with a new diagnosis of breast cancer will tell me that they don't care how things will look after treatment and that all they want is to be cancer-free. But to me, that's not okay, because it's almost never necessary to sacrifice one for the other. We can usually always get the cancer fully treated and have an excellent cosmetic outcome.
So obviously, we know it's a very challenging time when somebody's diagnosed with breast cancer. We want to be there to provide that comprehensive surgical care. We have an excellent network with our local physicians that we can provide that multidisciplinary team approach. We talk with our local oncologist as well as our local pathologist to really, once we have the diagnosis, develop a surgical plan that includes the goals that we've discussed between the team and the patient to make sure we give them the best outcome.
One of the most important things that I routinely do for my patients with breast cancer is to make sure that the entire treatment plan is the best one for her. Usually this involves 3 doctors, a breast surgeon, a medical cancer specialist, also known as a medical oncologist, and a radiation oncologist. Each one of these doctors has an essential part, and it's important that we all work together. I consider it to be my job not only to perform an excellent surgery, but also to make sure that every aspect of the treatment comes together at the right time and in the right way. Everything that we do for a woman with breast cancer is supposed to move her toward being cancer-free and cured if she can be. And there are many ways to get there in terms of the possible surgeries and other treatments that we need, but there's usually only one way to organize and perform them that will lead to being both cancer-free and having the best cosmetic and functional outcome.
There's a couple different ways. They can either call the clinic and schedule an appointment. They can talk to their primary care provider who can place a consult and our clinic will reach out. Or if they're savvy, tech savvy, they can use the website and request an appointment by that means.